Hello everyone, we are going to present a final formative research project for English.
Yeah. What is the methodology used to solve the problem? The study used a literature review, different science article, and medical texts were analyzed to understand leukocytosis. With left cells in acute appendicitis, the information was used to explain the concept normal blood values, and it's important for diagnosis is a simple and clear way.
What are the results of finding? The article found that leukocytosis with a left chair is common in acute appendicitis and reflects acute bacterial infection. The increase in white blood cells, especially neutrophil and their immature form, help doctor diagnose appendicitis. Therefore, leukocytosis with a left chair is useful not only as a diagnostic tool but also is an indicator of hope advance introduce the inflammation.
Okay, what are the conclusions? Okay, in the conclusion, the article about health things, the leukocytes with left shift, especially with a predominance of neutrophils in an important laboratory test to support the diagnosis, analysis the evolution of cause appendicitis. However, it must be interpreted in conjunction with a clinic evolution and other studies, as it doesn't on its own confirm the disease. Okay. What is the most interesting you learned from this research? In the first idea, we learned that the first line of defense against a bacterial infection such as occurs in alopecia areata, rheumatic fever, and bacterial endocarditis, as well as viral disease like polio and smallpox, is the immune system. The second idea, appendicitis, can become a very dangerous disease if not treated promptly, and it can rupture inside the body and infect others. And the final idea, I left shifting hematology in an increase in immature neutrophils, bands, metamyelocytes, and myelocytes in peripheral blood, indicate a bone marrow response to bacterial infections, inflammation, or severe stress.
Question number one. Does leukocytosis alone confer appendicitis? No, leukocytosis alone doesn't confer appendicitis. It must be evaluated together with cytol, physical examinations, and other tests to make an accurate diagnosis. Question number two. What does an increase in bands indicate? An increase in bands show that the bone marrow is releasing in nature neutrophils into the blood. This usually happens in response to a strong bacterial infection. Question number three. Why is the differential count important? The differential count shows the percentage of each type of white blood cell. It helps identify infection and assess the several of the diseases.
Question number one. What does leukocytosis with left sheet indicate in acute appendicitis? It indicates the presence of acute bacterial infection and reflects an increase in neutrophil in their immature form, supporting the diagnosis of acute appendicitis. Question number two. How is leukocytosis related to the state of acute appendicitis? The leukocytosis in the left sheet grade the severity and progression of the disease. Question number three. Which type of leukocytosis predominates in the left sheet is in acute appendicitis? Neutrophil segment neutrophil in their immature form, for example, bands, juvenile cells, and myelocytes.
Okay, in first question number one, what are normal white blood cells, the leukocyte, values in the blood? Normal white blood cells can range for approximate 4 to 10 of blood. These both serves a reference for identifying abnormalities. Since increases with blood cell count can indicate the presence of infection and inflammatory process as occurs in acute appendicitis. Question number one, number two. What does the left shift in the white blood cell count mean? Answer. It means there is an increase in your or in immature cells, especially neutrophils in the blood. This happens because the body responds to a bacterial infection by producing and releasing more definitive cells to find the microorganisms, which is the common in acute appendicitis. Question number three. Does leukocytes alone confirm the diagnosis of acute appendicitis? Answer, no. The article explains that leukocytes and the left shift are very helpful in the diagnosis, but they aren't sufficient on their own. The diagnostic must be made in the conjunction with a patient clinical evolution, a physical examination, and other complementary studies for reading accuracy.
Yeah. In question number one, how is a left shift related to appendicitis? It's a key laboratory indicator that signals to body response to infection, characterized an increase in immature neutrophils in bands in the blood due to severe inflammation and high infection rates. The question number two, when is neutrophilia considered present? It is considered present when the absolute neutrophil count, ANC, in the blood exceeds 7,500 for 7,700 cells, UL 7.5 for 7.7 for 10,9 in adults. And the question number three, what does it mean to have leukocytosis? It means having too many white blood cells in the blood. In the most case, this is due to an infection. Thank you for your attention.